Expanding the EUA to children is unnecessary, premature, and will do more harm than good. There is no emergency for children, especially healthy ones whose risk of severe illness or death is almost nil. Kids with pre-existing conditions and prior COVID infections were not included in Pfizer's study, so including them in the EUA is negligent. Pfizer's trial is woefully underpowered to detect specific space safety concerns such as myocarditis, just like the adolescent study was. And if they weren't able to detect an unexpected safety concern there, they wouldn't be able to here. In Pfizer's study, only 0.5% of controls were dropped due to important protocol violations versus 3% in the treatment group. The odds of that happening by chance are 1 in 10,000. This deviation is poorly explained with no ITT analysis. The study is not double-blind and may be subject to biases. From CDC reports, we can expect that for every 18 child hospitalizations prevented, at least 43 will end up in the hospital for all causes following vaccination. FDA's risk-benefit analysis only counts myocarditis hospitalization. Theirs shows alarming safety signals, which we have shown cannot be attributed to increased vaccinations, stimulated reporting, or COVID infections. We calculated the ratio of adverse events reported per million Pfizer vaccinations to reports per million flu vaccinations among teenagers to see what to expect in children. Serious events are reported 61 times more often for Pfizer, deaths 47 times, and life-threatening conditions 49 times. Here are the Pfizer flu reporting ratios for some adverse event categories. What are we doing to their reproductive organs? How can you expect young children to take these risks to protect adults? Look at myocardial disorders on the right and ask yourself why Pfizer's briefing document didn't mention their child sub-study on troponin levels. You should demand to see those results. There are over 900 types of adverse events reported in teens from Pfizer vaccination that have never been reported for flu vaccines, including 11 cases of MIS-C with no COVID infection, and that's before correcting for underreporting. Your approval today means mandates tomorrow. So in the name of millions of parents around the world, I implore you, hold the line.